Let's have a look at the classes of drugs that come in pre-medication. So the first class of drug is anxiolytic. Now, if most of the people who come for surgery, especially the ones who are first timers, are extremely anxious before surgery, and they are even more anxious about the anesthesia, because they would have heard horror stories like my relative went in for anesthesia and something wrong happened, kuch gadbad ho gaya, and he didn't wake up only, or rather he became brain dead and he didn't wake up from the anesthesia. Okay, so all these kind of horror stories puts into the mind of the patient that anesthesia is going to be difficult and this could be his last chance at life. Sometimes they'll say thing like पीछे बैक में कोई सुई दिया एंड वो सुई अब तक मुझे चुभ रही है, सुई अंदर ही छोड़ दी है, मुझे लगता है चुभ रही है. Okay, so when patients hear all these kind of things, they are very anxious about the perioperative factors. This anxiety is even more in pediatric patients. Okay, in pediatric patients you have a different kind of anxiety, and that is stranger anxiety. They are not used to seeing all these people roaming around in scrubs and trying to cuddle and coo them and take them inside the operation theatre and hold a mask on their face. So anxiolytics are used in pediatric patients, then in young females, because they are the class of population who are generally very anxious, and they are also used overall in patients who are not very cooperative to enter for surgery. Remember not to use anxiolytics in patients with CNS disorders, because this can lead to reduction in the ventilation of the patient, and you may not realize whether the patient is getting reduced ventilation, respiratory depression as a result of the CNS pathology or as a result of the medication. So anxiolytics sedatives are contraindicated in them.